Okay, good afternoon, everybody, and welcome to the Women's Global Health Annual Symposium. I think this must be our 12th, is that right, Luann? Annual Symposium. So I'm going to go right in and introduce our Dean of the College of the Health and Human Sciences, Dr. Bowman, or Dean Bowman. We're really happy to have him as our new dean.
Thank you, Dorothy. And thank you, everyone, for being here. Today, we're coming together as researchers, educators, advocates, united by a shared commitment to advancing women's health and improving the well-being of individuals, families, and communities around the world. Women's health research is fundamental to understanding the unique biological, social, and environmental factors that shape health outcomes. And this work exemplifies the Purdue College of Health and Human Sciences commitment and our continued effort to make lives better. We've seen remarkable progress in recent years, including the FDA's approval of the first medication for postpartum depression, a groundbreaking milestone in recognizing and addressing women's specific health needs. This achievement and many others like it are a testament to the power of dedicated research and innovation. At Purdue, the Women's Global Health Institute has been at the forefront of raising awareness and driving real-world impact in women's health through strong partnerships and a commitment to interdisciplinary collaboration. The Institute has funded innovative research projects that push boundaries and lead to tangible improvements in care and policy. In fact, that's important. One of the key roles that the WGHI does is by putting out pilot grants, which the college is eager to support. It brings together new ideas, researchers that have not worked together to address an important issue in women's health. Many of these transformative projects will be showcased here today, thereby highlighting the work that is being done to tackle critical health challenges. The College of Health and Human Sciences is proud to be a steadfast advocate and sponsor of women's health research. We recognize that addressing women's health issues is not just a priority. It is essential to the broader goal of improving public health on a global scale. By working together, we are accelerating discoveries, shaping policies, and ultimately enhancing lives. Thank you for being here today and for your dedication to women's health. I look forward to hearing all about the wonderful discussions and groundbreaking research. I just was seeing my postdoc, who was one of the judges of the poster competition. She was exhilarated by going from poster to poster, just excited by the work she's seen. So let's continue to push the boundaries of knowledge and innovation for the health of women everywhere. Thank you, and boiler up.
Thank you so much, Dean Bowman. I really appreciate the remarks and the continued support from the College of Health and Human Sciences. So I thought I would just give you a little a quick rerun of what we've done over this last year and a little bit about the Global Health Institute. So as you all know, I think that our goal is to bring together partners, find resources, do whatever we can to promote women's health research, as well as raising awareness about the issues in women's health. And so some of the, I love this little phrase, the conscience of women's health. Our external advisory committee called us the conscience of women's health because we try to bring people into the field. So our recent activities over the last year, just a quick rerun. We have our interview series, which we call Leading the Way, and we did 2 of them this year. And the goal of this interview series is to bring in people, I would say at the top of their career, who have done work in women's health research or promoted women's health research, and talk to them about that, but then talk to them about their career path. What were their challenges? Work-life balance, how did you manage to get to where you are, managing all those things, other things in your life? And our recent ones were Rebecca Dorsch, who is currently the provost of the Rensselaer Polytechnic Institute. And we also interviewed this year Paula Johnson, who is not only a cardiologist, but the president of Wellesley College. It was really wonderful interviews with them. This year, we launched our Women's Global Health Institute student organization. And for any graduate students, if you're interested in participating in that organization, there's a sign-up sheet outside in the hall. We have, again, run our small grants program. And in the past few years, we've been able to fund, with the Peachy, 6 grants every year for the last 2 years, which is really exciting. We can only afford one, but our partners have really helped us in funding the rest of our research. And this year, the Small Grants Program, we have commitments already from the Indiana Clinical Translational Science Institute, the Purdue Institute for Integrative Neuroscience, the Purdue Institute for Cancer Research, and thank you to the College of Health and Human Sciences to fund more of those projects for us. So we're really looking forward to that. It is in review right now. We meet next week. So we'll send out the announcement for that. The other thing we did this year, and Ulrike has moved into my words here, but is the Women's Health Initiative in November of last year. It's okay. So, and that was in response to the White House Initiative for Women's Health. And that was a really exciting event with the PIN, the Purdue Institute for Integrative Neuroscience, and the Engineering, College of Engineering. And I will say that several of the pilot grants that were submitted for this pilot grant program were based on partnerships that were created at that event. So I'm really happy to see how successful that event was in bringing people together and talking about specific projects. So I also want to say that the Catherine Peachy Breast Cancer Research Grant solicitation is still open, and I know that some of our Catherine Peachy partners are out here in the audience, so thank you for being here today. And the proposals are due on March 10th, and they're specific to breast cancer prevention and treatment. This is a picture of a number of the awardees, but also some of their board came down to visit us last fall, so it was wonderful to get to know them and be engaged with them. So thank you again for your support for us. But if you do breast cancer research, submit a project. And then finally, I'd just like to thank our sponsors for this event. The Purdue John Martinson Honors College, the College of Health and Human Sciences, our longtime advocate, the Purdue Institute for Inflammation, Immunology, and Infectious Disease. I never get that out, but PI4D, the Purdue Institute for Drug Discovery, and the Purdue Institute for Integrative Neuroscience. Thank you very much for your support. We couldn't do it without you.